Hi everybody, this is Dr. John Liu, founder of Doctor's Choice. Today I wanted to go over the ABCDs of Medicare. Now, if you're turning 65 or you're helping somebody who is, or maybe you're retiring after 65, you might be getting so much mail that you don't know what to do with. All this, zero that from all the insurance companies, from insurance agents. What does all of that mean? What is Medicare? How do you navigate yourself through the maze that's the alphabet soup, the ABCDs? So today I wanted to give you a quick crash course about Medicare, the ABCDs, and the one important decision that you have to make as an individual when you go through the system. So despite it being a fragmented system, Medicare actually works pretty cohesively to give you a comprehensive health insurance plan. So let's start with what is Medicare. Medicare is simply health insurance for individuals who are 65 years old or older, or those of you who are disabled under the age of 65 who have been disabled for 24 months. That's it. And the ABCDs, when people sign up for Medicare, they sign up for both Parts A and B. So A covers you in the hospital. A, for most folks, comes at zero premium, means that it doesn't cost you anything on a monthly basis, and it's because you've paid into the Medicare system. Now, A is not a comprehensive coverage for hospital services. With Part A, every time you go into the hospital, it's about, for 2016, it's $1,288 deductible per occurrence, meaning that you can ultimately, potentially pay more than the $1,288 or pay the $1,288 multiple times when you go to the hospital in any given year. And then there's Part B. Part B is outpatient. Outpatient includes things such as doctor's visits, outpatient surgery, labs, imaging. I like to see this as Medicare covered services that happens outside of the hospital and also outside of the pharmacy. So with Part B, for most folks, it's $121.80 per person per month when you sign up for Medicare. There's only one version of B. There's no multiple Bs. That's actually one of the most common misconceptions when people sign up for Medicare, is that they ask us, well, which B should we choose? So when you go on Medicare, you have to sign up for A, you have to sign up for B. Those two are basically the building blocks that allow you to enroll in Medicare and have Medicare be your primary insurance. With Part B, there's also out-of-pocket expenses. So it's $121 per month. And then for 2016, there's a $166 deductible. And then after that, there's a 20% coinsurance, meaning you're on the hook for 20% of whatever the cost of your outpatient services. Where this gets expensive is with outpatient surgery. We had somebody that had a pacemaker and needed to get switched out. $50,000 procedure. Under Part B, you're on the hook for 10 grand. There's no limit on how much you can spend with just Parts A and B. That's why most people, what they do to protect themselves against high costs when it comes to A and B is they choose a supplemental plan or Medigap. Supplemental plans in most states come in all these different flavors, plans A through N. And this A is not the same as this A, so just to make things more simple, I guess. With the supplemental plans, I like to call this, Cadillac coverage, if that's still politically correct. With the supplemental plans, the ones that we typically recommend will come in and cover most or all of the costs associated with A and B. That means the $1,288 when you go into the hospital, the $166 deductible, and the 20%. So that means that when you go to the doctor or the hospital, you don't pay a bill. And also, you get the flexibility of going to any doctor, any hospital in the entire country that takes Medicare with no referrals needed. So it gives you that flexibility of network. It minimizes your out-of-pocket expenses, especially if you're really sick or if you're procedurally sick, meaning you have multiple procedures throughout the year. You're in and out of the hospital. You go to the doctors many times. You do a lot of lab studies. You go to a lot of specialists. This route might be the right one for you because it's going to minimize your out-of-pocket expenses and maximize the flexibility of providers. Downside, price. That's pretty much it. And then supplemental plans do not cover you for prescriptions. So that's why most people also have to pick up a separate Part D, D for drugs, prescription plan. Now, in any given state, there's over 20 different Part D plans. We'll have another video on how to navigate Part D, but essentially the quick takeaway for Part D is that depending on what prescriptions and what pharmacies you go to, the Part D plan that you choose will be different. So don't pick a Part D plan based on just how much it's going to cost you on a monthly basis, because that's only a very, very small portion of the equation. So that's option one, what I call, the Cadillac plan: as much coverage as possible, minimal out-of-pocket expenses, the greatest flexibility to go anywhere. And actually, the majority of folks in the U.S. Pick a supplemental plan. There's also another type of plan called Part C, which is also called an Advantage plan. So you might be wondering, A, B, D, where's C? Well, here's C. C is a standalone. I like to see this as a standalone plan all in itself, because what Part C is it's a plan that takes a private insurance company like a Blue Cross or a United Health, takes your Part A, your Part B, and your Part D oftentimes, but not always, and groups it into an all-in-one plan. And it's a plan similar to the plan that you might have had from work, where there's a network. A lot of these plans are HMO plans. It requires you to get a primary care physician. They may need to give you a referral for a specialist, although not always. And with the Part C plans, there are out-of-pocket expenses. There are co-pays, set co-pays for doctor's visits, for the hospital. Some of them may have a deductible, some of them may not. And these plans are really good for people who are, they're pretty healthy, so they don't use the doctors very much, and they can save some money in the long run by not having to pay what a supplemental plan will cost. And also it's for folks who stay local, so a network is okay, although some plans give you more flexibility in terms of network than others. So the benefit of having a Part C or an Advantage plan is that it gives you the, in terms of price, it's typically less expensive than a supplemental plan plus a Part D plan. And then the downside is that you may have out-of-pocket expenses, which if you're chronically ill and you go to the doctors and hospitals and procedures, your out-of-pocket expenses may cost you more in the long run if you choose a Part C plan. And also there's that limitation of network for most of these plans, so that if your doctors are not covered by the Part C plan that you choose, then you could have to, you'll be in a situation where you have to choose whether you want to go for another plan or choose another doctor. The other benefit with the Part C plan is that they'll often add additional benefits in there that traditional Medicare doesn't cover. So Medicare does not cover you for dental, does not cover for basic dental services, typically doesn't cover you for your routine eye exam every year. It doesn't cover you for glasses unless you have cataract surgery. And it doesn't cover you for long-term care. So Medicare covers you for up to 100 days in a nursing home. It's really for short-term rehab, after which you're really on your own. That's where, if you have money, that's where you're drawing down on your assets. It's when you have long-term care insurance, that's when that might kick in. Or if you're on Medicaid, which is a state assistance program, the state may come in and pick up some of those costs. But for the Advantage plans, some of the Advantage plans will add in little bonuses, such as they'll cover your vision exam. They'll give you some money towards glasses. Not all the plans are required to do so. Some do, some don't. And some of them might add in dental as either an add-on or an integrated part of the plan. Some of them may also offer things such as gym memberships. So and these plans really focus on a lot of preventative care. So if you're a healthy individual and you stay local, then it's worth it to take a look at these plans, because as long as you stay healthy, you will save more money and you're going to be able to get extra bonuses that Medicare may not cover. So that's it. That's the one big decision that you have to make when it comes to Medicare, is whether you want the supplemental plan with a standalone Part D drug plan, or you go with the Part C plan, which oftentimes will come with a Part D plan included for the same price. Before you go into any particular plan, start comparing between plans, make this decision for yourself. Figure out what's going to work out for you. Are you the person that's going to be, are you going to be a snowbird? Are you going to be living in multiple parts of the country for months at a time and need the flexibility of network? Or if you're sick and you need multiple specialists, multiple procedures annually, what are your out-of-pocket expenses are going to look like? And also, what prescriptions do you take? Because what plan you choose, especially Part D and in most cases the Part C plans, there can be big differences, especially if you have lots of brand name medications. So again, that's the big decision you have to make. Let's talk about when to do what. Now, at the time of this filming, we're close to what they call the annual enrollment period, which is called AEP. Every year between October 15th to December 7th is the Medicare annual enrollment period. During this time, if you're already on Medicare, if you have A, B, and you have either a supplement or D plan or Advantage plan, that's when the new plans come out for the following year, especially for Part D and Part C plans, and you get to take a look at what the changes are going to be next year and decide whether you want to stay or you want to switch. Now, the key here is most people fall into the trap of, I'm happy with my plan this year, it's done great for me, why do I need to change? Well, especially with Part D and Part C plans, they can change anything any given year. So with Part C, they can change what doctors they cover, what prescriptions they cover, how much they charge you. For Part D, they can change what pharmacies they cover, what drugs they cover, and at how much. So that's why it's wise for you to do a search so that come January, you don't have any surprises at the pharmacy, or you go to the doctor and they say, well, we no longer take your plan. And so this is the annual enrollment period. Takeaway here is review your plan options, because it's going to be, again, you want to prevent surprises, and I really wanted to emphasize that. Now, if you're new to Medicare when you're turning 65, you have 3 months before to 3 months after to sign up for Medicare A and B. And so this is a 7-month period. Now, the earliest that your plan can start is the first of the month. Even though you can sign up 3 months before, the earliest that it can start is the first of the month that you turn 65. So let's say you turn 65, May 20th. The earliest your plan can start is May 1st. And Medicare always starts on the first of the month. It can't start in between. A lot of you are working past 65. Now, if you're working past 65, the time to sign up for Medicare depends on whether you're going to be covered by your employer. Some people might say, well, my employer is charging me a lot on a monthly basis for my Medicare, for my health insurance. I might be better off going on Medicare, doing the math. How much is Part B going to cost me? How much is either Part C or supplemental and D plan going to cost me? And if it's less than what my employer charges me, then I might want to consider whether I want to stay in my employer plan or go on Medicare. Now, you can still work and be on Medicare. Your employer cannot force you to go on Medicare to save money for the company. That decision has to be absolutely yours as an employee. So, but let's say we work with a lot of universities, a lot of nonprofits that have these really rich benefits plans. So what happens in that case is if you're working past 65, most people will sign up for Part A. It doesn't really give you much, doesn't really take away much in a big company. And it's a placeholder. So, and then when they retire, there's a special election period that opens up that allows you to sign up for Part B essentially anytime during the year, so we can coordinate with when your employer plan ends. So you don't have to wait to the annual enrollment period, and you will not incur a penalty because you've been covered under your employer plan. And then after you sign up for A and B, that's when you can decide to sign up for the supplemental or D plan or the Medicare Advantage plan. And then also for folks who are disabled under 65, the 25th month, so if you've been disabled for 24 months, you're eligible for Medicare. If you're collecting disability, they'll sign you up for A and B 3 months before you turn 65. You get that card in the mail, and with that card, you can sign up for the rest. Just keep in mind that in different parts of the country, if you're disabled under 65, supplemental plans, certain supplemental plans may not be available to you, or they may be at such a high price that it doesn't make sense. That's a quick overview of Medicare, when to do what, and the big decision that you have to make. We'll also do a few more videos on penalties, surcharges, and also go through some case studies as to what each plan looks like from a practical perspective. Now, if you have any questions about this, feel free to reach out to us at doctorschoiceusa.com, and we'll share the link with you, and or give us a call at 401-404-7373. And we hope to see you again, either at one of our local seminars or to see you in our office or speak to you in person. Thank you.